They eat hard food.
Mm-hmm.
So here we come on to problem number X.
Yes,
How
number
many I've
X.
come
Yes.
to. So the diet in primitive countries is much harder.
Mm.
Then they don't have Moulinexes and blenders and Gerber baby foods.
Yes, yes.
They have to have what their adults eat.
Mm.
And they can be chewing on leathery old biltong, dried meat, dried food that isn't soft.
Mm-hmm.
And they develop, because of that, wide arches.
Mm.
It does go with eating a harder diet. Now,
Yes.
the research on arch size with diet is fascinating because they've done a lot of it. They've done it on primates, they've done it on guinea pigs, they've done it on monkeys, they've done it on pigs,
Mm-hmm.
they've done it on mice.
Right.
And what they've found is that the softer the diet, the smaller the jaw.
Yes, yes, okay.
And if eventually you'll create just a liquid diet, they will not develop a lower jaw.
Really?
In some animals like mice.
So was Weston A. Price's work really the forerunner of this research you're describing, or was there work before Weston A. Price? Or?
Weston Price was right on the button.
FC2O. From chaos to order. From chaos to order. Here we go. From chaos to order. From chaos to order. FC2O.
Andre Hedger is much more than just a dentist. Andre has strived his whole career for excellence in dentistry, which includes understanding not just a lot about teeth, but the impact of dentition on the rest of the body and the rest of the body on the dentition. To give you a sense of Andre's explorations, he is a Fellow of the Hypnotherapy Society and a founder member of the British Society for the Study of Craniomandibular Disorders. Andre is also a member of the British Orthodontic Society and the International Association for Orthodontics. He's a member of the British Dental Acupuncture Society and the British Society for Clinical and Applied Hypnosis for Dental Phobia. He's also a member of the International Academy of Oral Medicine and Toxicology and Patients Against Mercury Amalgam Fillings. He is in the British Dental Society for Dental Sleep Medicine, as well as several other specialist groups. So, beyond his passion for holistic dentistry, Andre is a real modern-day 21st century Weston A. Price, exploring the far reaches of indigenous cultures where, combined with some extreme climbing, Andre often assesses Aboriginal dental health and, as you'll hear, generally concludes he would be out of business if he tried to set up in what some would consider a primitive culture. We have much still to learn, and Andre is going to take us on a journey into how health itself and healthy teeth are inextricably interlinked. Enjoy the show. Here we go. Welcome to another edition of FC2O with me, Matt Wallden, and my guest today, Andre Hedger. Andre, welcome. Thank you for joining me. So, Andre, you and I met, I believe it was about 2001, something like that, at the BNI breakfast meetings in Leatherhead or Fetcham, somewhere around here, somewhere local.
A long time ago.
It was a long time ago. And it was just at a point in my career where I had been made aware of how important the TMJ was. And of course, when I was introduced to you, it was really, Andre's the local dentist. But once I heard you start to speak and started to go to some of the courses that you were running and your colleagues were running, I realised that you're much more than just a standard dentist. So let's dive into the sort of journey that you took into dentistry to start off with, just so that people get a feel for how you got in and how your career progressed to where you're at today.
I started dentistry because I fancied a job that was physical and actually hands-on with patients rather than prescribing drugs from behind a desk. I'm very practical with my hands. I like the idea of mechanics and fixing and mending and having a relationship where you can communicate with the patient on a more personal level than, say, a doctor behind his desk with his prescription pad. So I started dentistry. I qualified at Guy's Hospital. I'm a Bachelor of Dental Surgery and of the Royal College of Surgeons. I'm a licentiate of dental surgery. So I sort of got two qualifications at that time. But I also did, during my training, a scholarship in South Africa. Now, having trained at Guy's Hospital, which my mother thought was the bee's knees,
Yes.
I realised when I went to South Africa that actually it wasn't. there are universities, there is training programs around the world that are on a completely different level, in my opinion, much higher. I did feel a little bit behind what they were studying there.
Right.
And then I realised that when I qualified, I had only just begun the journey, and I must continue to learn and never stop learning. From the minute I qualified, I didn't think that I was qualified. I just thought I was licensed to start.
Right.
I started in practice and started going on a lot of courses, and I realised an area that we had not studied at university, and they still don't study at university, is the jaw joint. The relationship of the jaw joint and the teeth, for me, became an area that no one seemed to know about, and I thought it was worthy of study. What I noticed were a number of patients, a lot of patients, coming in with jaw joint problems, and through my lack of knowledge, I decided that this was an area we really needed to focus on. It can cause, if you have a deranged or dislocated or damaged jaw joint, it can cause immense amount of problems. Headaches, neck aches, migraines, backache, chronic fatigue, and it can make a person very ill.
Psychologically as well. That's right, isn't it?
Physically. They can become on what we call a spiral of despair.
Yes.
And the profession has no real answers for that. So the typical patient may well go and see a maxillofacial surgeon who might prescribe a splint to protect the jaw from the jaw joint, and he might put the patient on drugs. It's usually amitriptyline as an antidepressant, muscle relaxant. So that was as far as they go. They might go to a neurologist who do a brain scan, but they nearly all do.
Right.
And that usually reveals nothing. So no one's really made the connection with the jaw. So this tranche of patient, this great pool of patients, is not really being cared for by anyone.
Sure.
So I started the study group, the British Society for the Study of Craniomandibular Disorders.
Yes. And when was that? Do you remember?
About 20 plus years
ago. It
ago.
must be 20 plus years ago, because I think I went about 19 years ago.
I think it's probably about 25.
Probably was.
And the idea was to study this and invite speakers from all over the world that were experts in that field, which we did. We had meetings where we just talked with colleagues, other dentists who were interested in this, and we started to take a big interest. So the journey on that road has led me down to not just TMJ problems, but muscle movement disorders. So muscle movement disorders are things like dystonia, where the neck may twist to the left or the right. So torticollis is what some people call it. Basically, you get a wry neck and you can't move your head forwards, or you might have it just pointing upwards. It may cause tics.
Yes, I was going to ask about that. So this is these twitches that people get. And
twitches, they can be vocal.
Yes, so like Tourette's.
Tourette's is another muscle movement disorder. They are all linked. They're not independent items. Tourette's is not a disorder that's separate from any other muscle movement disorder.
Right.
And then blepharospasm, for example, which is chronic blinking.
Oh, okay.
Tick in the eye.
Yeah.
This can be so severe that the patient can't see, functionally can't see, can't work, can't walk.
And do you know the mechanism? If we get a little technical, is there a described mechanism, or is it?
There is a described mechanism, and how it's considered to happen. And a few papers have been written on this, which show that if the lower jaw, which is clicking or dislocated or causing a jaw joint problem, is too far placed in the skull, the head of the lower jawbone can compress a nerve at the back of the skull, a very important nerve called the auricular temporal nerve.
Yes.
Now this nerve is a key player and emanates from the trigeminal nerve, which is the fifth cranial nerve, and it's a very important brain nerve.
Yes.
If that auricular temporal nerve is actually physically compressed or squashed, it can crossfire and send signals, almost like you've delayed a train at Clapham Junction.
Right,
Other
right.
trains coming in can't work.
Yes.
In this case, what happens is when you actually squeeze or squash that nerve, it can send signals to the reticular ganglion, which is right in the back of the brainstem.
Okay.
And then that can make other nerves crossfire.
Mm-hmm.
The key ones are the glossopharyngeal, which is the throat and swallowing nerve.
Yeah, yeah.
And it can then affect the optic nerve, which is the eye nerve.
Mm-hmm.
So you can get little tics or tremors in your eye. With the throat one, you can get a feeling of hoarseness or fullness in the throat, difficulty swallowing. You could make a vocal tic. You might shout, swear, scream, wail like a werewolf, or just swear, or spit.
Yes.
It has many manifestations, and that's where Tourette's comes in.
Wow.
And the last nerve is the accessory nerve, which can cause the shoulder to shrug, the hands to twitch,
Yes.
and the head to rotate.
Right.
When all three nerves are affected, Tourette's, the French physician described that as a syndrome.
Mm-hmm.
The classic teaching for that is drug therapy and deep brain stimulation, electrodes in the brain to try to stop the firing.
Mm-hmm.
But what Anthony Sims in America and Dr. Brendan Stack in the States and other workers in this field have found that if you decompress the TMD, basically stop the lower jaw squashing the nerve and bring the lower jaw forwards, you can, by decompressing the nerve, you can often get rid of the symptoms.
Right. I've seen video of this, because so there's video of this on YouTube maybe?
Yeah,
or
lots of videos.
Yeah. And it can be almost instantaneous, can't it, in some cases?
It can be quite dramatic. You can almost stop it in an instant. A lot of other cases, if they've been going on a long time, can take a while to do.
Yeah.
And some don't resolve. It's almost as though the muscles are constantly fired and will not unfire, even with decompression. In my practice, it's about 80% successful. 80% is not bad, I don't think.
Yeah.
So what the reason and the etiology is commonly is a narrow upper jaw. And as the patient grows, the lower jaw, which is on a different growth part to the maxilla, as you know.
Yes.
It has a preordained growth length. If it's against a narrow upper jaw, then it tends to grow backwards, and then the jaw joint gets squashed and affected because the lower jaw has a length to grow. The upper jaw is restricting it, what we call fencing, maxillary fencing. The upper jaw is the maxilla, fencing the lower jaw, and then as it grows backwards, the jaw head of the jaw joint squashes back against the back of the skull.
So essentially the lower jaw should fit within the upper jaw.
Yes.
When the upper jaw isn't as big as it should be, then the lower jaw grows backwards and presses against these important
Exactly.
structures.
And the issue is small upper jaw.
Yes.
That's a subject that we can discuss the etiology of that shortly. But the small upper jaw can impinge the growth of the lower jaw, and then it grows back. So my interest in this subject has grown and grown. There's arteries and nerves and other things that can be squashed, blood vessels, by the jaw being back too far, which can cause myriad of symptoms. If it causes headache, neck ache, migraine, chronic pain, jaw pain, then concomitant with that, at the same time, chronic pain can lead to depression.
Right,
because it just wears you down. So depression becomes a very big part of it.
Right.
And if you have depression, then a lot of conventional doctors would consider depression as the problem.
Yes, exactly.
It's just the symptom of a mechanical dysfunction.
This is an interesting thing, isn't it? Because I'm sure we're going to get onto this a little bit later, but one of the things that I've increasingly become aware of as I've understood more and more the function of the body, the interactive components of the body, is that, of course, gut issues can also cause depression. So this whole thing with the microbiome and the idea that if the microbiome's out of balance, then that can cause decrease in serotonin production. Without enough serotonin, you start to move into increased risk of depression. But we also know that same imbalance in the gut microbiome can create tooth grinding. It's quite a common kind of
link.
Yes,
Definitely.
yeah. So there's all these kind of interactions, and tooth grinding, I know, is a symptom of TMJ dysfunction, but can it also cause it, or
Well,
not
it's
so much?
usually a function of it.
Yes,
So
okay.
you don't usually find people with healthy jaw joints tooth grinding.
Yes. Okay.
About 20% of the population tooth grind.
Mm.
About 45% of the population have a clicking or deranged jaw joint.
Yeah.
Which is quite startling.
It's quite high, isn't it?
When you mention the serotonin, it's quite interesting because it should be intracellular. And in jaw joint cases, they've extracted the inflammatory fluid in the jaw joint, and they've found serotonin in the jaw joint fluid, and that's not the right place for it to be.
Right. Wow.
They've also found in 30% of women that it contains chlamydia.
Oh, wow.
And they found that the inflammatory products, that you would imagine to be there, hyaluronic acid, arachidonic acid, and the other inflammatory products, it's almost a toxic soup when the jaw is deranged.
Wow, that's amazing.
And that is what can cause the extreme pain.
And is the chlamydia, I know obviously it's best known as a sexually transmitted disease, but is it because it's anaerobic and it can survive in that environment? Yeah.
Exactly.
Okay.
Because it's not vascularly being supported because it's been compressed.
Okay.
So there's a whole neurovascular bundle about 6 millimeters wide at the back of the jaw joint, which is sacred, and the lower jaw should never encroach into that space. It's highly sensitive, highly innervated. And if the lower jaw is back and squashing that whole complex and reducing it to no millimeters, then the pain can be extraordinary. And that's why that group of patients has formed dozens of forums and patient groups, and is really finding that the medical profession hasn't really got the answer for them.
Right. And can I just ask, the little pinky test that you taught me, which is to put your little pinky fingers in your ears and open and close the jaw.
Yes.
And you shouldn't really be able to feel compression there as you close the jaw, is that right?
That's right.
Yeah.
So if you put your little fingers in your ears with a soft pad pointing forwards, put it quite away in your ears, open and close, and when you bite on it, you bite on your teeth, not on your fingers, but you bite on your teeth. If you feel the jaw joint squashing your fingers, then it's usually too far back. And also you would feel, and you can feel, the clicks, grating and grinding that's going in a deranged jaw joint where something's wrong with it, really clearly yourself. It's a very good test.
Yes.
So for a patient, they might want to try that because you can't always hear them and you can't feel them by just touching the outside of your ear. Sometimes that test is really definitive.
Yes.
The other thing, when you open your jaw, it should be in a straight line, and it should open about 50 millimeters. The average is 52.
Right.
So if you can't open in that range, you've limited opening, it deviates, it clicks and grates, then there could be an issue for you. So the small maxilla is usually the devil.
Yes.
And the angel is the lower jaw.
Yeah.
So we've got to look at the cause, which is the devil.
Yeah. Sure. Okay.
And that's another story of how do we develop that? Or why have we all got narrow upper arches in the West?
Yes.
So would you like me to expound on that?
Yeah, well, yeah, I'd love you to.
Want
Yeah,
to talk more about?
No, I think that would be great because that leads us into so many other areas, and I'm fascinated to see where you go with it because I've got a few ideas myself, but I want to hear where you go with it.
Okay.
So go on, let's start.
So I would start with modern Western society as being quite sick, and environmentally, structurally, physically, emotionally, I feel that the West is beginning to go backwards. De-evolution, not evolution.
Yes.
And it starts with preconception. It starts with the woman and the man. I don't think that the quality of the sperm is as high as it was. I think a lot of women have issues with candida, and they're not as healthy as they could be when they're conceiving. They're exposed to a world of toxins. They're exposed to antibiotics in their diet from animal feed and from taking antibiotics themselves.
Mhm.
They're exposed to hormones in the form of the contraceptive pill before they decide to have children,
Yeah.
and they've got hormones in the food. Their health of the vagina is usually poor, and it's usually very laden in candida
Mhm. Mhm.
and hasn't got the right biome for it.
Yeah. Just to jump in, I always think that the word gynecology is quite an interesting one, isn't it? Because gyne means womb,
Yeah.
and ecology is the ecology of the womb. You know, so
Yeah.
it's the flora and fauna, if you like,
Of that
of that area. Yeah. And we often just see it as diseases or issues, medical issues there, but actually it's really to do with the biome there.
Exactly.
Yeah.
And I think our nutrition in the West is very poor. We're already showing that sperm counts are going down, fertility is going down,
Yeah.
women are having children a lot later. So the woman conceives eventually, somehow, and the baby grows, and the woman delivers the baby. So this is the second stage of where I see it going wrong. I think all deliveries should be done vertically, in a squatting position.
Yeah.
Now, I've travelled extensively around the world.
Mm.
In fact, I've just come back from Madagascar,
Right.
3 weeks.
Yeah.
And I've been in Mali and Ethiopia and Yemen and Eritrea and Morocco and Algeria. So I've seen in those countries, they don't go to hospital and lie down. They squat for delivery.
Yes.
But they can also, as people, squat. They'll often be seen squatting at the side of the road waiting for a lift or transport.
Yeah.
Now, us in the West, we can't squat for long, squiddly squat.
Yes,
we
that's
can't
true.
Squat.
Yeah.
I can hardly squat for 5 minutes. I think it would nearly kill me.
Yeah.
But I think for women, they should have some method of delivering the baby vertically, whether they're supported, which they would need to be, maybe in a bath or some medium that takes the weight off them.
Yeah.
Because if they're not, the force of birth is nearly 30% more required if you're laying on your back, according to some papers I read.
Yeah.
So if you're exerting more force on the baby as it's coming out, you're distorting the cranium more. You're actually stressing the baby more as it comes out. And a lot of births now aren't even being able to be done vaginally. They're being done cesarean.
Yeah.
And the birth, when it happens, even with a cesarean, is very distorting to the baby because the baby's often very engaged
Right.
at that point, which I hadn't considered. I'd considered that the baby would come out much more perfect. But no, not so. So they come down the birth canal, and the first mouthfuls and the first exposure to bacteria, which would hopefully colonize their gut, is candida or thrush, because it's often very infected on the way down, which is not a great start for a baby to start with an infection of thrush in the gut, because then it doesn't help them form a good
microbiome.
microbiome in the gut at all. They're off to a sticky wicket.
They're
often very cranially distorted. Usually the left temporal bone in the cheek is more inward, internally rotated, we say, than the right. And the left side of the face is usually smaller than the right side of the face, quite distorted. I personally am a great believer in cranial osteopaths getting the baby in the first week to try to straighten them up.
Sure.
I paid for my 3 children to have that service done, because I think once the distortion is left in too long, it's like a bent sapling, it'll be a bent tree.
Yes, exactly. Yeah.
Very easy to straighten at that early stage. So now we've got a baby that's born that's got the wrong gut flora. It's got a distorted face that no one's corrected. And it comes into the world, and because of the wrong gut flora, it's also going to be more prone to becoming allergic. And the mother tries to feed the baby, and this is another, and I'm not a mother, so I can't really criticise.
Yes.
I don't think the breastfeeding is done long enough.
Sure.
I think the breastfeeding is done the wrong way. So the next issue is the baby's being breastfed horizontally. like in a cradle, like
Sure.
cuddled. And it should be breastfed vertically,
Right.
as all African peoples do.
Do they? Okay.
All primitive
I didn't
peoples
know that.
breastfeed them vertically.
And is that because they're sort of straddling the hip, the baby?
Straddling
or?
the hip, yes,
Yeah,
and
right.
they just don't believe in laying them flat.
Yeah, yeah.
Now, if I invited you here and said, would you like to have a drink with me, and we're going to lie on the floor to drink it would be very difficult.
Yeah, yeah.
And it's very much the same with the baby. As they're trying to suckle, they're struggling to breathe, suckling and breathing at the same time. If the milk's too prolific, then they develop a tongue thrust to stop the flow.
Right, right.
And as they push that tongue forwards to try and stop the flow so they can breathe, then there becomes all sorts of issues with aberrant tongue swallowing.
Yes. And can I just ask you, does that also tie in with being bottle fed as well? Because I know tongue thrust is a quite
Very
complex topic. But
yeah, so this is, we'll come on to that because that's the next part.
Yeah, yeah.
So what happens in breastfeeding, especially if you do it correctly, vertically, and the breastfeeding should go on for a year at least, not just a month or so.
Yeah, yeah.
Many of them, even my own children, haven't persevered as long as I'd like with my grandchildren.
Yeah, yeah, yeah. Right.
But hey ho,
Yes,
I can't
yes.
make people do things.
No.
Now they're very active suckling. The nipple goes right down into their throat. It elongates hugely, maybe an inch and a half, hard to imagine.
Yeah.
And to suckle, the baby has to pump the nipple right against the palate in a rhythmical method, which is basically expanding the palate
Right.
as it's doing it.
Yeah.
And so good expansion of the palate from day one is generated by good breastfeeding. So a wide palate, you'll see more of those in people who breastfeed. If the mother stops all too soon, as they often do, or says they can't, which is a hard thing to swallow, because if they were in a primitive country, the baby would die if they couldn't, but I don't think they would stop.
Yes, that's right. That's right.
That's just a personal.
Well, I've seen figures on that as well, and I can't remember the exact figures, so I won't try to spout them out. But it was the case. It was in Sudan when there was famine there, and they had the Red Cross, one of these big centres there. You might even have told me this figure, but I seem to remember reading it. And essentially, the question is like how many of the children born during that famine period were breastfed, and the answer was that every single one of them was. And so it's to me, I mean, like you say, you have to be very careful as a man giving women advice. And yes, exactly. But at the same time, when the chips are down, and that's the only option, then you make it work.
Exactly.
Yeah.
So if it doesn't work, and understand nowadays, for a poor woman, I mean, I'm not going to go because the pressures of life are unbelievable.
Yes.
Working, my children are working and trying to bring up children. It's not easy. There's so much pressure. So they might start bottle feeding. Now the plastic latex nipples, or what do you call them, nipples, on feeding bottles are not necessarily shaped correctly. They're not the same as a human nipple, and they're quite strong, and they require a different type of suckling. The flow is quite high. The effort involved is very little.
Yes.
The flow can be so high the child will be struggling to drink and breathe, and it makes the tongue thrusting worse. It's high, it's quite a strong material, and it tends to create a high vault, a high roof of the palate.
Yes.
If you imagine the palate's like a church roof, a high vault would be a very arched one at the top, where the rubber of the teat has made it into that shape, which narrows the upper jaw even more, significantly narrowing the upper jaw.
Yeah. I've got an image here. Is that the sort of thing you're talking about there, Andre? Because we could put that on the show notes.
Yes, that's absolutely right. That narrow arch where the teeth can't all fit in. An orthodontist would look at that case and immediately be wanting to extract teeth to fit all the teeth in. The whole issue of a narrow arch that we would be considering is that the tongue is wider than the arch. The tongue now can't fit in the arch.
Sure.
The tongue creates the wide palate, and if the tongue suddenly, because of all these factors, You might also have an allergic child because he's had the wrong start,
Yes.
eating the wrong food, can't breathe through the nose, becomes a mouth breather, and that creates an even narrower palate. As the palate narrows so much, the tongue now has nowhere to go, so it drops down.
Right.
And it doesn't, it can create what we call a class 2, where the upper teeth are a long way ahead of the lower teeth.
Yes, yes.
And that makes the lower jaw go further back. So if you can't swallow properly, you have an aberrant swallow, then there's all sorts of factors in nutrition affected by that.
Yeah, yeah.
So we see many of the patients with such narrow arches, they can be up to 1 centimetre too narrow. And they're the ones that often have extractions for orthodontics.
So tell us about the extractions, because that then goes into another sort of spiral of
issues.
Challenge. Right.
Of course.
Yeah.
So what happens is they're trying to fit all the teeth in. There's a few not fitting in the arch at all because it's a V-shaped narrow arch. And a conventional chap might look at that and decide that some teeth need to come out, and then the teeth can all be shuffled around.
Right.
Made to look reasonable from the front, made to look nice, but in a restricted arch,
Yes.
and which the tongue can't fit in. The stability of that arch orthodontically is not so good, because the tongue will create stability if it can get in there.
Yeah.
But if it can't, because it's wider than the arch, then the problems continue.
And is this an economic thing? Is it just much easier to extract a couple of teeth and then try to align the rest of the remaining teeth, as opposed to doing brace work?
It's partly economic and it's partly historical, because as orthodontics started, that was considered de rigueur. The thing to do was to extract teeth, because it was it was a simple solution. When you look at plaster models on the table, you think, oh well, those teeth, too many, move them and shovel them around, that would be nice. But the whole idea is for health, and holistic thinking would be, where's the tongue going? How are we going to get a good swallow? How are we going to achieve stability? If the mandible goes back, the lower jaw goes back, the airway is compromised. If the airway is compromised, you'll often find the child has disordered breathing. So it might just be snoring, it might be sleep apnea. And if we don't have correct breathing, if we have mouth breathing, because of the nasal breathing is far more efficient at filtering and protecting the lungs from the air and pre-warming the lungs. The air as it before it hits the lungs, and it's a much more efficient method and moisturizing it than mouth breathing. Because of the mouth breathing, that can create an open mouth.
Yes.
Now if the lips aren't together, the arch will get narrower, and the crowding will become worse. Because of the mouth breathing, the jaw will drop down and the mandible would usually go back. And the health of the person will reduce. So
this mouth breathing, of course, then leads onto another cascade of physiological challenges for the individual quite frequently, because it's sending them into this kind of fight-flight state and this jumpy mind, ADHD type mind. So that's, I assume you see a lot of patients with those kinds of
What's really
profiles.
intriguing is that TMD patients have a much higher ratio of ADHD and OCD than the general population. Very much higher.
Yes.
And the link to that is quite significant. What's really intriguing to me is the fact that the upper jaw, if it's narrow, is also the floor of the orbit of the eye. And it also attaches to the sphenoid bone in the back by the palatine bones and the pterygoid plates. So if the jaw is narrow on the upper, then there's an effect on the eyes. And there's a lot of eye problems in the West. A lot of people needing glasses. And what you sometimes see when you look at someone with a very narrow upper arch is a very deep pooling under the eyes. Venous pooling. So where the veins are not draining very well from the upper jaw. So it'll look as though you've got bags under your eyes, or it'll look as though you haven't slept for a month, and yet you have. If you look at the whites of the eyes of those patients, the white part, the sclera, will often be very blue. Where the veins are also not draining from the eyeball properly. And the narrow arch will create issues with the airway of the nose for breathing. And so the nose might be blocked. There might be deviation of the septum. We've already found that from the birthing process, deviations of the upper jaw are quite common. And then therefore the airways congested. So now we're really into adenoids enlarging with the inflammatory response.
Yes.
The tonsils enlarging, and often that's also part of the allergic syndrome.
Yes.
Because if you look at the patient, the gut has not got the correct flora either.
Yes.
And the whole thing is a spiral.
Yeah.
It's very fascinating because health versus illness is multifactorial.
Yes.
And I find with if you can expand the upper jaw, which we as orthodontists can,
Yes.
we can really develop the jaw with soft, light forces, applied light forces. Using gentle pressure on the maxilla, you can widen it almost to its genetic potential, full genetic potential. You can eliminate those dark patches under the eyes. You can improve the complexion of the eye. You can improve the airway by simply widening the nostrils.
Yes.
And supporting the upper jaw, which supports the upper lip and giving a very attractive appearance.
Yes.
Once the upper jaw is widened to the correct diameter and width, then the teeth will usually all fall into place.
Yeah.
But it's worth mentioning, it's definitely worth mentioning, that in the West we don't really have room for our wisdom teeth as well.
Right.
Now, form with function is the byword, as you know.
Yeah.
And if you're a baby that's been suckled correctly in a primitive country, you'll be starting to eat hard foods quite early.
Yes.
You'll also be walking very quickly.
Right.
There are no buggies.
Yeah.
I saw one buggy in Madagascar. I was there for 3 weeks.
Right.
Kids walk. There are no nappies. They're potty trained very early. They work very young. They start working the children in where I was at age 3.
Right.
It's astounding.
Yeah.
I've never seen anything quite so much, even in Ethiopia. So the children are upright, they're carrying things on their head, their posture is amazing. If you can balance a pail of water on your head and walk to and fro from the river to your house, then you will have usually elegant posture.
That's kind of like an extreme Alexander technique, isn't it?
Extreme, but they can do it.
Yeah.
And they are barefoot, so they don't have dropped arches like we do in their feet. So their posture is usually amazing. They're tall, they're elegant, they're proud, and they're working as we were designed to work. I go there, we're all carrying rucksacks, and they're all carrying our rucksacks if they're helping us get them onto something on their head.
Right, yes.
We don't have the neck musculature for it, and we all have a lot of neck problems in the West. That's where keeping the osteopaths.
Yes, exactly.
Somewhere busy.
Yeah.
So I find that intriguing. They have the right physique. They eat hard food. So here we come on to problem number X.
Yes,
how many I'll come to. So the diet in primitive countries is much harder. Then they don't have Moulinexes and blenders and Gerber baby foods.
Yes.
They have to have what their adults eat. And they can be chewing on leathery old biltong, dried meat, dried food that isn't soft. And they develop, because of that, wide arches. It does go with eating a harder diet. Now, the research on arch size with diet is fascinating because they've done a lot of it. They've done it on primates, they've done it on guinea pigs, they've done it on monkeys, they've done it on pigs, they've done it on mice. And what they've found is that the softer the diet, the smaller the jaw.
Yes, okay.
And if eventually you'll create just a liquid diet, they will not develop a lower jaw.
Really?
Some animals like mice.
So was Weston A. Price's work really the forerunner of this research you're describing, or was there work before Weston A. Price? Or?
Weston Price was right on the button.
Yeah, okay.
And I'd like to do a modern Weston Price. And in fact, I've been in talks with the BBC
Really?
Tentatively on doing a programme on comparing the health of a primitive country's children to our Western children.
Oh, wow.
What we would look at would be, say, posture, body mass index, strength. We look at the maxilla, the upper jaw, the lower jaw. We look at their arches on their feet, their pelvic alignment, their whole health in terms of their gut and their strength, and also their mindfulness and their mental health. Because in my understanding and watching people in these faraway places, in Ethiopia I looked at 100 children and I didn't find one narrow arch. I didn't find plaque. I didn't find any cavities.
Really? Wow.
I saw healthy upright children with full arches on the feet. No one had dropped arches, in perfect posture. And if I'd gone there to run a business, there would be no business.
Yes, right.
And I just found it fascinating.
Yeah.
Now, if I looked at 100 children in England, I might find one that was right. If you look at the parameters of what we consider correct.
Yes.
So I think the Western way of life, the head down, the looking at the computers, looking at the iPad, slumped over a desk, sitting at a desk hours of the day doing school, and then watching television 4 hours a day is average. It's crazy.
It is,
and the children are not getting out, that we are developing a lot of forward head posture, which then exacerbates the problem with the jaw.
Yes, because essentially as the head moves forwards, the musculature that would normally, I guess, be somewhat lax in letting the jaw move forwards is now sort of held on tension and pulling the jaw back. Is that right?
Yes, and the airway's compromised.
Yes.
So often they have to hyperflex the head up to actually breathe properly.
Yes.
So it all sounds doom and gloom and extinction.
It does.
Prediction, but it is.
Yeah.
And I think we need to look at where we should be and come from and where we're going. And we can walk into it wide open. We can have the mobile phone stuck on our face and we can look at computers forever and a day. But the patients with TMD that suffer the most are people who do IT as a job.
Do you know what? I was reading a paper earlier today. It's just been submitted to the Journal of Bodywork and Movement Therapies, who I write for. And I probably shouldn't say too much about it because it's not published yet. But essentially, it was looking at cell phone use and activity of the muscles of mastication and trapezius, and essentially finding there's a direct correlation. The more you use your cell phone,
the more they work.
The more kind of sensitized they are, and facilitated.
I can absolutely believe that because you can feel it heating up your head. It's got to have some effect. If you talk on it too long, you can feel your head's hot. So is the handpiece. But that's another story. So we're on to very narrow maxillas, conventional treatment of teeth out. We're on to a lot of injury. Injuries are a very common cause of jaw problems because of whiplash. Any whiplash can create the head back.
Yes.
The research is showing that about 45% of whiplashes get a jaw joint problem.
Right,
It cracks the jaw open, it makes the jaw open in a slam open too much, can tear ligaments and can cause problems.
Yes.
And because of the multifactorial nature of what causes a narrow jaw, we can't pin the blame on anyone or anything. We can say the orthodontist didn't help by taking out teeth and creating a straight smile but in a narrow arch because the narrow arch was there in the first place.
Yeah, that reminds me of that phrase about knowing about the tooth, the whole tooth, and nothing but the tooth.
That's right.
It's kind of the focus is the teeth.
And the focus is, when you are focused on the teeth, you are doing that and you're doing a good job.
Yes,
And the teeth look great and everyone's happy. But when you get older, this is the correlation between the jaw joint problems and the teeth are quite interesting because if you have the brace work, it's usually done about age 12, 13 or 14. But the lower jaw has a little growth path of its own and doesn't stop growing until about 25.
Yeah, I remember this.
And it has a big spurt of growth from 18 to 25.
Is that in both sexes?
Yes.
Is it? Yeah, okay.
Yes. More in men than girls. It's
Yeah.
called a post-pubertal growth spurt.
Right.
And it's approximately 6 millimeters forward growth. So you know when you know the little boy next door, and then next time you see him, he's like 18, he's grown into a man.
Yeah.
It's usually a subtle forward growth of the mandible that makes him look more manly.
Yes, yes.
And the same with women.
Yeah.
So when the mandible grows forward, the entrapment can become more obvious.
Right.
The
Okay.
condyle, the head of the lower jaw is called the condyle. The head
Yes.
of the lower jaw might have had to grow backwards because the lower jaw was fenced in by the narrow upper
Yes.
jaw.
Right. I see. Yeah. Yeah.
And so between 18 and 25, the mandible, the lower jaw might grow back a little bit more than it could or should into that rather delicate space behind the lower jaw,
Yeah.
and can compress the tissues there and the nerve. And that's why things like the dystonias don't usually start till about then,
Right.
or the headaches don't start till
Okay.
about then.
Okay.
And so therefore there's not a link with the orthodontics.
Yeah. Yeah. I see. I see.
but
yeah. No.
On the internet, people are making the link much easier now because
Yeah.
information is on there.
Yeah. For sure. For sure.
And like in the anti-vax literature on the internet, some of it's flawed, but
Yes.
some of it's not.
Yes. Yeah.
And it's the same with the information about the jaw joint.
Mm-hmm.
But the patients are getting a lot more cute
Mm-hmm.
and a lot more aware, and I'm actually all for that.
Yes. Yes.
I think you should read everything,
Yeah. Yeah.
all the pluses and all the minuses.
Yeah. Yeah.
You should read what the conventional guys, like the government says,
Mm-hmm.
we should all have the MMR.
Mm-hmm.
There's lots of people who say we shouldn't.
Yeah.
You can't rubbish the anti-vax people as all fake news.
No.
Once you start doing that, you're starting to become a bit like President Trump.
Yes,
in
exactly.
America,
Yeah.
When you're starting
Well,
to...
we had Dr. Sherry Tenpenny on one of the earlier podcasts. Again, for that reason, because I wanted to understand what she had to say and what her views were. Obviously, she's anti-vax, but actually, some of her views aren't as kind of polarized as you might think. And she was giving examples of times where vaccination could be very beneficial. But in general, she's quite anti-vaccination. But yeah, I'd be interested to interview someone who's very pro-vaccination and get the balance of the
Because I'm very anti-vaccination.
Yeah.
Because I have a child that was damaged by vaccination.
Right. Yes.
But and I've also been an expert witness in an anti-vaccine trial.
Have you? Okay.
So I know a lot about vaccines, but it's another story.
Mm.
So I feel that the assault on our children from birth,
Yes.
so if we go back to the birth,
Yes.
we've got the child, the poor child is conceived by parents who are not healthy. It's maybe not got the healthiest sperm to set it going, or egg.
Yeah.
It's born in a very tight, constricted canal when the patient's, the person, the mother's lying down, not vertically. It's exposed to the wrong environment as it comes out the birth canal, basically Candida. It's exposed to a very toxic world when it comes out. The world's full of insecticides, pesticides, herbicides, and carbon emissions, and pollutants on an unbelievable scale. Unbelievable scale.
Yeah.
Sadly, we all think it's normal, but you just have to see the smog in a city to realise the first breaths the child takes are full of those particulates.
Yeah.
So then the child's brought up, it's breastfed, maybe incorrectly, it's getting a tongue thrust, it's maybe put on milk with the wrong stuff, creating allergens, and then it's vaccinated. Now, a healthy child that's vaccinated is fine if it all goes well, if the child can cope with the antigenic shock. But if it can't, and there are side effects to vaccines, and the Committee of Safety and Medicines, who publish yellow cards for doctors and dentists, we can access those. They show all the adverse reactions. We cannot say it doesn't cause adverse reactions.
Yes.
We all know it does.
Yes.
But if your child just happens to be the one that gets the adverse reaction, then you've injected into your healthy, gorgeous, bouncy baby something that's made it ill.
Yes. Yeah.
When it didn't necessarily need it. So it's
sure.
a hard call to call.
Yes.
And my 3 children have made their own choice. I didn't want to influence them on that, but they've all chosen the non-vaccine.
Yes.
But against a lot of opposition from the medical profession that support them in the child's development.
For sure. Yeah.
So then the child's growing up and eating junk food. I don't know why.
Does this link? I know this is a slight segue, but some of the issues that have been well documented as potential, having potential impact on the child's health from vaccination, is the mercury that's within certain vaccines, and also the aluminium that's within the vaccines. And in fact, more so in the last 5 or 10 years, the aluminium seems to be coming under the spotlight even more than the mercury did. But there's a link there, obviously, with teeth and with amalgam fillings and this kind of thing.
The bigger ingredient, I wish they'd call it mercury preservative, but they call it names like thimerosal.
That's right.
As a preservative, because if you make a vaccine, algae and that will grow in it unless you put something that's bacteriostatic in there.
Mm-hmm.
So what kills bacteria is mercury.
Okay.
But we think it's cool to put it in the mouth, in teeth, and I don't believe that is the right way to do it, because mercury is proven to be released from mercury fillings.
Yes.
And the vapor is toxic. If we have waste mercury from the dental practice removed, they have to come in special suits to take it away. It's a hazardous substance.
Yes.
Can't be thrown away. Can't be put into the rivers. And it can't be thrown away in general rubbish because it's toxic.
Yes.
And yet we've just taken it out of someone's mouth, which is slightly odd.
Yes.
But we know that it releases mercury vapor. There's a lot of research to show that. And the mercury vapor tends to collect in the brain and kidneys.
Yes.
And there's lovely research to show that. So when the mercury is in the brain and kidneys, it has an effect on the tubules, the neurons in the brain, and it can have an effect on the beta tubulin, which is basically the sheath that surrounds the axons and dendrites in the brain, the little nerve cells.
Yes.
And it's like the insulation of an electric cable.
Yes. Yeah.
And if the mercury gets involved, it can make it come off.
Right. Yeah.
Basically, the beta tubulin combines with mercury.
Yes.
And then what's left is just the nerve, and it can, in research that I've seen on snail neurons and axons, if you actually put some mercury in with them, they shrivel out, they wrap up and tangle, just like spaghetti would, mixed up.
Wow, yeah, that's
quite fascinating. So I don't think if we've got alternatives, we should be using it.
Do you remember I referred my sister to see you because she'd been diagnosed with multiple sclerosis. Actually, I'm not sure if they made the diagnosis by the time she saw you or whether that came afterwards. But she had been getting visual symptoms, and it had come after a hygienist appointment where they cleaned her mercury amalgam fillings. She'd been given or advised to get a sonic toothbrush, and she'd been cleaning away on these amalgam fillings for 3 months, and then she started to develop this. I'm not sure if scotoma is the right term, but a part of her field of vision that was missing essentially. And I sort of made the connection with the potential for there to be damage from the mercury, and I suggested that she get in touch with you. She came in to see you. You removed her fillings for her. And the neurologist, because she had optic neuritis, this was the diagnosis from the MRI scan. And, as soon as I heard that, I thought that's not good, because I know that's often the precursor to multiple sclerosis. Anyway, so she saw the neurologist who said, well, look, I can't diagnose you with multiple sclerosis because you only had one episode. So it's technically it's singular sclerosis, but when it comes back again, then you have multiple sclerosis. That was his explanation to her. And that was about 5 years ago, and it hasn't come back. And, obviously, I guess we won't know until either it does or it doesn't. But that was 5 years ago now. And one of the things that I've seen, one of the figures I've seen, is that mercury levels are on average 7 times higher in multiple sclerosis patients than they are in the general population. So, you combine that kind of information, of course, that's just the n equals 1 number, or experiment or whatever, but when that's your sister,
that's good. I didn't get the follow-up.
Yeah, no, I did. I was wondering if you ever
later heard. I didn't realise, but I just think we need it. It's an extra load.
Yes. Yeah.
Some people can cope with toxins more than others, and I think why have we got autism on such a level? What they found is if they put autism patients here, the mercury excretion of them is the same or lower than the normal population.
Right.
But what they found is if they put them in a Faraday cage, where there's no electromagnetic stimulation on them, they release more.
Ah, okay.
And there's a lot of castigating of the research done to show the link between it,
Yeah.
but there's commercial pressures,
Yes, of course.
government pressures,
Yeah.
and so the truth is not quite as clear as it seems.
Exactly. Yeah.
So I think people have a right to look up
Yeah,
and talk at the school
Can you
gates.
explain the Faraday cage thing just a touch more? Because I'm not sure I've quite got my head around that. Do you?
Yeah, so what they put autistic children.
Because the Faraday cage does it block electrical?
It blocks electromagnetic fields, all
Yes.
electromagnetic fields, even the Earth's electromagnetic field. And then they found that the kids with autism released far more mercury than an average child.
Right.
Whereas it seemed that the electromagnetic radiation was somehow holding it in them.
Okay. Yes.
Fascinating to me. I don't know. I think we'll find out more in years to come.
Yeah, of course. Yeah.
I don't think we'll know the whole story. But I'd love to come back in 100 years and go, what have you found out?
Yes, exactly. Yeah. I once had a patient who came in who had her entire mouth filled, supposedly prophylactically with amalgam fillings, by some dentist down in Bristol, and she was up this way, and she said, when I was in my 20s, this guy said I should just have the whole lot done because I've got a family history of cavities, and it would save me a lot of dental work in the future. I couldn't believe it. But is that a practice you've heard of? Or?
Yeah, I've seen it.
Okay.
Basically, before we had fissure sealing, we hadn't got bonding to the teeth.
Right.
What the dentist would have done is drilled tiny little runways in the fissures of the teeth, like fissure sealing with mercury. For
Oh, I see. So
I think it was a bit radical.
Yeah.
Now ill-conceived, but a lot of what I did in my early days, because I've been practicing over 40 years, I now consider wrong. So we think we know what's right now. 40 years when you reflect back on it, what is right? And that's what's why you can't be dogmatic about what's the cause of that.
Sure.
You can't be dogmatic about the vaccines, although there is research to suggest there can be issues with them.
Yeah.
So I think as a patient, it's a bit of a minefield. As a punter out there in the wide world, what do I do? What's best for my child? So in my work, mainly I'm working on widening the maxilla, not just in terms of width, but making sure the front teeth go more forwards to allow freedom for the mandible.
Yeah.
I'm freeing the victim, the mandible.
Exactly,
by tackling the devil, the maxilla, the upper jaw, and having a lot of success with that. That's why I've not retired just yet.
Right, excellent. And how do you do that? That's brace work primarily?
Yes, using light wire forces in the upper inside. That is, so you put in an appliance that's slightly wider than the arch.
Yes.
And this gentle pressure just pushes the teeth.
What kind of pressures are we talking about?
About 300 grams.
Right, okay. Yeah.
And the forces are very light, or less. And the forces actually encourage the bone to grow with the teeth, to move with the teeth. We don't just tilt the teeth, like a lot of people suggest we do. We actually can widen the palate a centimetre.
Yes.
I've done many cases where I've widened it a centimetre.
That's amazing, isn't it?
And if you just tilted the teeth, they'd be on their sides.
Yes, exactly, yes. Yeah. And does the tongue change its function as a result? Or
yes,
we have to train
them to tongue swallow properly. So there's a lot of myology involved, tongue training exercises to learn how to swallow correctly. And once the swallow is correct, and once the tongue can fit into the palate, a lot of things just unravel.
Yes.
We have a lot more stability because I've got a lot of long-term results where 10 years later we've still got the wide palate. Because even the British Orthodontic Society, the orthodontist body in Britain, say that we should have retainers, plastic retainers, for life.
Right.
So that implies that it's not going to be stable. Well, it isn't. And what is stable? It's a hard one. But, the most stable results I've seen are where the palate's wide and the tongue fits in there.
Yes.
And the patient's got their lips together and breathes through their nose. There's an old dentist who's now retired, John Mew, and he was very much of the opinion that we should start with making sure that kids or the children have their lips together. And his devices that he used to develop the upper arch were also made the child have to keep their teeth together and their lips together so they would nose breathe. And by nose breathing, nasal breathing, the arch would develop much better.
Mm-hmm.
Now, his devices are quite hard to get used to, and not everyone wants them, but I don't use them. But I've seen long-term results of his, 30, 40 years post-work, his work, and the results are astounding.
Yes, yes.
Now, he's been criticised by the profession.
Yeah, of course.
And I always find when people who are doing wonderful work, they often are exposed to being criticised.
That's it, yeah.
But
yeah,
I'm
yeah.
not, I don't use his technique,
Yeah.
but I have seen a lot of the work where you get the lips together, you start nose breathing, you do not mouth breathe at any cost.
Mm-hmm.
You can develop nice wide arches very easily, and they're very stable.
Mm-hmm. And isn't there, I remember you telling me a figure about, I've forgotten the name of the chap in Sydney who did research into the modelling agencies there, and he found that there was
Yes,
no
it was Derek Mahoney, and he did a lot of research with models. He found that nearly all the models had not had teeth out.
Yes, yes.
And they had wide arches and palates.
So there's an aesthetic side to it.
Airway, and also the lip, the pout of the lip. If you want pouty lips and to look like a Greek goddess or an Egyptian lady, with a beautiful lip, and the upper lip profile matching your nose, then you need all the teeth in there.
Right, okay, yeah.
And then ideally it would be lovely to get the wisdoms in, and quite a lot of my patients have. But I think it's false to say you're non-extraction dentist, because a lot of patients still need the wisdom teeth out.
Yes, okay.
And that's just how it is.
Yeah, sure.
So I think you can't say I've done a wonderful orthodontic job and then 5 years later they go and say, well, I've done my wisdom teeth. No, there's no room for me.
Sure, okay. So I know we've mentioned Weston Price, and actually the paper that I showed you the image from just earlier in the discussion, this is a guy called Jerome Rose and Richard Rob Lee. But what I found interesting about this paper is that I think it was out, let's see what year it was, 2009, but it seemed to have very similar information to what Weston Price was showing, 100 years previously, more or less.
Yes. And I think that's absolutely fantastic, because we like to keep thinking we're very modern.
Yes.
And yet there's people in the past who've done work and research on the very same topic. And we're wrong to think that it's outdated and it's not blinded and researched and clinical trials and it's not randomized. We should be looking at it. I once invited a very famous speaker, the inventor of fixed braces, to talk to us at a study group. He was in his 80s. Bob Ricketts, his name was.
Right.
He was sort of godfather of orthodontics.
Yes.
And he gave his talk about the work they were doing in the 50s on the jaw joint.
Yeah.
He says it's all lost, but we keep reinventing it and starting to do it again.
Yes.
And he says they're critical of old work because it may not be randomized.
Yeah.
Clinically gold standard to our modern standard, but the work's still there. And it was very interesting, the fact that we're losing. I mean, Weston Price's work is old, but there's other people doing it, and I would love to do it myself if I retired and someone would fund me.
Yes, exactly.
And if the BBC, if I can get them actually interested in that, to do it. If there's any of your listeners that are program broadcasters, it would be so interesting.
It would be a fascinating program.
It would be
absolutely
unbelievable. It would be show-stopping, because we would realise how ill our children are. We'd realise how unhappy they are. We'd realise how stressed they are.
Yes.
We'd realise how fat they are. We'd realise how unfit they are, and how poor their posture is, and how poor their dentition is, and their swallowing, and their airway, and their breathing. And we would start to think maybe that we've got it wrong.
Yes, absolutely. And the thing is that all of those things you just mentioned, it's quite a long list, but they're all so interactive, aren't they? That, when you have poor posture, for example, then that will impact on jaw function, but also poor jaw function will impact on posture. But then we also know that if you've got poor posture, that impacts on emotions, but so do emotions impact on posture, and the loops just are round and round. And all we need to do. This is an example. I called the podcast FC2O, which is From Chaos to Order. And so what I'm trying to do is to speak to people that have essentially been in a field where they've really achieved a level of mastery in that field. And what almost always emerges at the end of that rainbow, if you like, is this simplicity that, emerges from the complexity. And really what it seems to boil down to, as you've just explained, is breastfeeding, eating healthily, having healthy parents, healthy nutrition, natural foods. It's really all quite simple things in many ways, but we're quite far removed from it.
We're so far removed from it. I know Paul Chek's book, and I have another book, Paul Chek's book, Eat, Move and Be Healthy. It's the move bit. And there is no such thing as healthy food. It's just eating, in the right
natural
proportions.
Food, yes.
Natural food.
Yes.
It's not some food that's really unhealthy, unless you're looking at poisonous food. So I feel that, we've got a nation where a third of women over 30 are on antidepressants, or some hideous figure. We're spending billions on it. Why is it so depressing living in England? Why are we all so stressed? Why are we all getting so obese? And we all are, as a nation, generally. And I find it very disturbing, because I think we're building a problem for the future.
Yes, for
Big
sure.
problem.
Yeah.
And I think we need to reflect back.
Definitely. Now, we haven't mentioned Possinger's cats, and I think perhaps with good reason, because I know Price and Possinger had a lot of close affiliations, and Possinger had found, somewhat controversially, a number of different things with his cats, but when he fed them foods they weren't evolved to eat,
That's right.
then they had dentition issues. Their midface again seemed to be the area which really shrunk in size.
That's right.
And I think even though there's been some, recent critiques of his work showing that I think it's taurine that cats need and gets denatured by cooking foods, so that was why they had these growth deformities. Nevertheless, it kind of still shows that when you are not getting the foods or sufficient foods to meet your nutritional requirements, then it seems like for some reason it's this middle third of the face that gets affected.
And I find that work really fascinating. I find it fascinating there was a dentist all those years ago, and he bred these cats for 5 or 6 generations. They were notibiotic cats, so they were sterile from birth, so they weren't affected by the environment. He split them into 2 groups. One group was a control that ate healthy food, and one group wasn't. But the issues with each generation of cats, they were getting iller and iller on the Western diet, getting more flu, getting more birth defects, feline flu, cat flu, and allergies, and then they were not producing, and I don't think there was a 5th generation.
That's right.
And I think we as humans, we're on the 3rd to 4th generation of Potterton's cats. That's how I look at it. And I look at it as well. I look at global extinctions. We've got the extinction party there, a bit like the passenger pigeon that, bred into the super millions, and a few years later was all gone. So what is happening in humanity is a little bit worrying.
Yes, definitely. Now, one area I've been interested in just recently, and I know we've got to round off soon, so I wanted to just get this in before we finish, but I've been reading a bit around central sensitization and the idea that, of course, there's many different things that can cause sensitization of the nervous system. And this sensitization, essentially, for people that haven't heard of it, is where, it's very commonly talked about in low back pain, and, someone can have perhaps quite a minor injury in their low back, but it can persist, and even then the scans show there's nothing wrong with the back anymore, and yet they've still got this persistent pain. And often that's because the nervous system is sensitized.
Yes.
And so the research that's been done on this, what's often called central sensitization, because it's sensitization of the central nervous system, shows that TMJ dysfunction is a very common cause of that. Now, have you seen much of that yourself? I know probably in a roundabout way you have.
In a roundabout way I have, because sensitization is is where the nerves will keep firing,
Yes.
even though the stimulus is gone.
Exactly.
And that's like phantom leg injuries,
Mm.
where you've had your leg chopped off and you can still feel it. And it's a really big issue. And after you put the mandible, the lower jaw, into the right place and open the arch and decompress, you can still have a lot of the symptoms,
Yes.
which won't go away.
Mm-hmm.
Because once the rhythm's set to fire, they won't unfire.
Yes.
And I think it's a big problem. The other issue that clouds a lot of what we do is some of these issues are set by drug induced.
Yes.
So psychotropic drugs and antidepressants, a number of them can cause dyskinesias.
Right.
It's called tardive dyskinesia, so it means body movement disorders or symptoms that are permanent.
Right. Oh,
And
okay.
they're caused by the drug.
Yes.
And they can mimic TMD
Right.
or a functional problem,
Mm-hmm.
and they're untreatable.
Mm-hmm.
And there's a whole host of people affected by it.
Right.
There's also a whole group of people who've been affected by Botox and botulinum poisoning,
Yes.
which has affected their brains
Wow.
and their central nervous systems, because it is very toxic in some people.
Mm-hmm.
It's like the bell curve. You get the people who cope with things in the normal, you get the extremely successful ones, then you always get someone at the base that's something's not gone right. So I have patients who are very worried about Botox poisoning and have started patient groups. There's a lot of them in those.
There's a couple of questions I had for you. That one is that I remember you talking about China types. I think you called them China types, or maybe glass types. But it was like they're
Crystal patients.
Crystal.
Yes,
there you go. I knew we'd get there.
patients.
Crystal. And so these sound like, because I remember you saying that to me maybe 20 years ago or so, and me obviously getting a feel for what you're talking about. But having read around central sensitization, it seems like those are exactly the people that you're probably referring to when you said crystal types. So these people, what would be an example? They just the slightest thing could trip them up, and they
could come into your surgery and it's too cold, it's too hot.
Yes, yeah.
The fan's blowing on me too much.
Yeah.
The lights are too bright.
Yeah.
And they're the princess and the pea types. Now, I ask patients whether they think they're a crystal, a delicate type, princess and the pea, plastic, that's someone in the middle who bends with the flow, or a steel. Steel people they don't feel anything. They can have a deranged jaw joint, not feel a thing. They can have a cut leg. I'm a bit of a steel myself. I don't even notice I've got a cut leg.
Yes, yeah.
Or I've got a fracture.
So you had a few injuries yourself when
Yes,
you're climbing falls.
Yes, I broke my front tooth just a few weeks ago.
Yeah.
In Madagascar, and I had to have it pulled out.
Right.
And it was extracted in a very primitive setup. Without anaesthetic, and it was fine. I didn't really feel it too bad at all. But there was no numbing. But some people, this would just be life-changing.
Yes.
It would be terrible.
Yeah.
They wouldn't be able to cope with that. So if you are a crystal person, then I think you are more hypersensitized.
And does it relate to health in general, would you say? I mean, like,
I think
crystal
so.
types generally not quite as healthy as the steel types? Or is
I
that difficult?
would say so.
Yeah.
They usually have very poor muscle tone.
Yeah.
When you, if you palpate the muscles, they're very weak. They don't feel as though they're there. And I'm not sure their nutrition is very healthy. And they're often very needy and vulnerable. And they have other issues.
Sure, yeah. So the other thing that I was triggered to think of when you're talking about the Botox is that, of course, some of those muscles that are being injected with Botox, particularly around the face and cranial areas, are still involved in TMJ function to a greater or lesser degree, I imagine, or is that?
Yes, they're used they're used by neurologists and maxillofacial surgeons. Sort of paralyze the muscles, clenching, chewing, and they're used in the dystonia patients because that means a dystonia is where the neck may twist round.
Yes. Yeah.
It means one of the muscles in the neck is firing and the other's not. So it's rotated your head, but you can't get it back. So those patients, they can't even look forward, they can't walk, they can't work.
Right.
And they're very sad. So they have Botox in the muscle that's contracted to try and straighten this up. But eventually the Botox doesn't work.
Okay.
And eventually they get sensitized to Botox, so they need different types of Botox.
Mm-hmm.
But it's not like getting to the cause of the problem.
Yeah.
Which is what I think fundamentally you and I want to be considering.
Exactly.
For a
Yeah.
healthy future, for our grandchildren's children.
Yes, exactly. Yeah, and that kind of takes it beyond the individual, doesn't it? So it's this idea of a biopsychosocial approach is that it's of course you want to help the individual and their biology that's in front of you and their psychology, but that psychology and biology also extends out to their social group, and what we're talking about here is the impacts of things like TMD on the social group, but also how societal norms impact on the functioning of the individual, and how that can lead on to this whole kind of cascade of
Downwards.
issues that we see. Yeah,
The spiral of despair.
yeah,
Because if you look at my cases, it's nearly 60% of them have considered suicide.
Wow.
Because there's a question on my
I didn't
questionnaire.
know it was that high. I knew it was an issue with TMD, but I didn't know it was that
It's
high.
an issue with people who've got chronic illness, but that
Yeah.
one is, and that makes it. We realise it's the severity of it.
Yes, yeah, for sure.
But I think if we want to make a healthy nation, people like Extinction Rebellion, I don't agree with closing down London, but I think that we do need to start seriously stopping the pollutants and taking a look at, say, mobile phone use, and not just going, it's a necessity, and being much stricter with our children, and
Yes,
not letting them have iPads, when they're very young,
sure.
and not letting them sit gormlessly in front of the television, letting them out into the free world, to run in the forest and give them some freedom and some scope,
Yes.
and not be so paranoid about their safety.
Sure.
So that risk-averse society, which I see now, has become to such a degree that,
It's creating its own set of risks, isn't it? In a different way.
Risk-averse.
Yes.
They want to Dettol the surface as soon as the kids sneeze.
Yeah,
As soon as you've gone to the toilet, they want a chemical air freshener to pollute the house. And
Yes.
it's become obsessional.
Yeah.
Even the number of times people wash and chemicals that we're exposing ourselves to on a considerable daily basis. And the average woman is exposed to over 300 industrial chemicals in one day.
Wow.
Using her makeups, foundations, removers, body sprays.
Yeah.
That's a figure I read, and they absorb 5 pounds weight in chemicals a year from their products that they use on their face. And you just think, hold on, we need to start reflecting on everything.
Yes.
All of us.
Yes, for sure.
And that's, to me, what holism is about. Holistic care. You've got the handle on it. You come in with the primal foot to keep your arches strong and supported.
Yeah. The 5 fingers.
And you've kept your body in good health, and that's what we've got to do. It's our temple. God's only given us one body. Not necessarily in God, but we have only one body. It is a little temple. We do need to look after our own. And I look at people who not. I look at a lot of people out there, and I feel sorry. I feel sad. It's emotional problems.
Yes.
That a lot of issues that are making people unhealthy.
Yeah, for sure. So, Andre, before we finish off, I know that there are lots of people that will work with the TMJ, lots of dentists that work with TMJ. But what would you say if people are out there looking for a TMJ specialist that's of a similar kind of standards or holds their standards as high as you do? What should they be looking for? What should they be asking for?
They should be looking maybe on our website.
Yes.
Which is jawache.com.
Yes.
It's not tricky.
Yes.
Jawache.com. I think I was lucky to get that one.
Yeah.
The British Society of the Study of Craniomandibular Disorders has got people like yourself in, osteopaths, chiropractors, physical therapists, who also have an interest in the craniomandibular system.
Yes.
Cranio meaning the head, and mandibular the jaw. They're two separate bones, but they're all part of the skull and the head. And in there's a list of practitioners who are, but very few are doing it. It's very, very few. I see patients from all over Europe. And yesterday I had someone from Finland, and another lady from Spain. Well, this is nuts. Coming to me for their braces.
Sure.
Every 4 weeks. I mean, that's a global footprint in itself. But the fact is, there aren't enough of people doing it. And one of the problems is the restriction of the regulators and conventional teaching. Doesn't want people to be looking outside the box. And I think outside the box is where the interest is.
Yes, exactly. I tell my students when I'm teaching about the TMJ of a patient of mine who actually referred to you, and she decided to go with a different dentist who was a lot cheaper. And part of the reason they were cheaper was they weren't using dynamic MRI scans and some of the other methodologies that you use. And unfortunately, she had quite a bad experience, and she was suicidal because I believe her disc got caught through the brace work, and she was in extreme pain for several months. And so I just say that this is why people like Andre use quite high-tech facilities to make sure that you're doing everything you can to move things in the right direction, as it were. So is that something people should just be a little aware of as well, or is that difficult
I think you've got to do it thoroughly and properly, and you want a correct diagnosis. And to me, a correct diagnosis is using gold standard X-rays and MRI and other tests, electromyography, so that you're actually looking at the muscle tone of all the muscles and the current they're firing, and numerous other tests that we do, because you want to make an accurate diagnosis, and then the patient who has the problem really understands what the problem is. They can actually visually see, they understand all the words, they know what they've got, they can decide whether they want to deal with it or not, or just put up with it.
And what would I know it's a variable duration, but it's not a short duration thing typically, is it?
To treat them is about 2.5 years. Because if you can't expand a maxilla very quickly, the arch won't widen more than 1 millimetre a month.
Right. Yes.
And then you've got to line up all the teeth, and then you've got to move the lower jaw, or let the lower jaw come forwards. So it's quite a long-winded process. But I find it, as a practitioner, I find the ones that don't work, where maybe they're sensitised, maybe it was drug-induced. I find that's what I go home and remember.
Yes.
I don't remember all the good cases.
All
the people that praise me or buy me wonderful presents, or just thank me, and follow me from then on. I always remember the ones where it hasn't worked, because I want 100%.
Yes.
But in medicine, nothing's 100%.
Sure.
If it was, we'd have the eureka moment. So as a practitioner who cares, I find it very unsettling to me if I can't win them all.
Yes,
but
exactly.
I'll try.
Exactly. Yeah, fantastic. Well, thank you so much for your time today. That's been fantastic. I know we could have carried on talking for a lot longer, but you have to run off to an appointment. Maybe we'll do another one down the line. But now, people, obviously, you mentioned the general website, jawrate.com, but where can people actually find you if they want to contact you for an appointment?
If they look up Andre Hedger on the internet, if they look up Excellence in Dentistry Limited, we're there, and we're in Great Bookham.
Excellent.
Surrey.
Fantastic. Well, thank you very much, Andre.
Pleasure.
Appreciate your time and your expertise, and thank you for helping us to make a bit of order from the chaos.
Thank you. It was a real pleasure talking to you.
Excellent. Brilliant. Thanks.
FC2O. From chaos to order. From chaos to order. Here we go. From chaos to order. From chaos to order. FC2O.
So there's a bit of an overview of the work of Andre Hedger as a leading holistic dentist and TMJ specialist. Andre's description of his observation of patients who he classifies as crystal types fits almost perfectly into the cutting-edge research in central sensitivity, which is where my current research interest is, and is the core topic of my upcoming seminars and workshops. It's also why TMJ screening is such a key component of the check system that I teach and practice, and you can hear Paul Check talk about his interest in TMJ on our earlier podcast, the first one with Paul, podcast number 5. If you know anyone who'd benefit from the topics we covered, please do share it. All contact details and other information discussed can be found on the show notes at mattwallden.com. Thank you for joining us. I look forward to seeing you on the next show.